She came to the hospital holding her stomach in pain. Her face was pale and her voice was weak. "Doctor, I've had this pain in my upper belly for 2 days. I keep vomiting. I can't eat anything." She thought it was gas or maybe food poisoning. She had taken antacids from a local pharmacy, but nothing worked. What she didn't know was that her pancreas was in danger. And if she had waited longer, things could have gotten much worse. Today, I'll tell you her story. But more importantly, I'll explain what this condition is, why it happens, and what you need to know to protect yourself and your family. Hello and welcome to the Awareness Program. Let's talk about a condition called acute pancreatitis many people have never heard of, but which can be very serious if not treated on time. The woman I mentioned earlier was 38 years old, a mother of two. 2 days before coming to the hospital, she had attended a wedding. She ate a heavy, oily meal. That night she felt bloated. She vomited once, then again in the morning. She thought it was just indigestion. But the next day, the pain got worse. It was right in the middle of her upper belly, and it would shoot to her back. She couldn't eat, couldn't sleep, and kept vomiting. She felt tired, sweaty, and dizzy. Her husband brought her to the hospital. When we checked her, her blood pressure was low. Her pulse was fast. Her stomach was tender when we touched it. We immediately ran some tests to find out what was happening inside her body. We took her blood. 2 important things came back very high: amylase and lipase. These are like digestive chemicals your body uses to break down food. But in her case, these chemicals were leaking and damaging her own body. We also did an ultrasound. What we saw was that her pancreas was swollen. What is the pancreas? The pancreas is a small organ behind your stomach. It's like a helper that makes juices to digest food and helps control sugar in your body. But in her case, her pancreas wasn't helping, it was getting damaged. She had a condition called acute pancreatitis, which means sudden swelling and injury to the pancreas. Let's understand it. Your pancreas is like a chef inside your body. Its job is to prepare juices that help break down food. But sometimes, due to gallstones or fatty food or alcohol or some medicines, the chef spills the hot oil on himself instead of the cooking pot. Those juices don't go to the stomach. They start eating up the pancreas itself. This causes pain, vomiting, and sometimes dangerous complications. 1. Gallstones, small stones in your gallbladder that block the flow of juices. 2. Alcohol. Drinking alcohol damages the pancreas directly. 3. Fatty foods or oily meals, especially if the person already has gallstones. 4. High triglycerides can block the pancreas. 5. Certain medicines. 6. Viral infections. 7. Sometimes, we don't know the exact reason. We call this idiopathic pancreatitis. In her case, she had gallstones that were blocking her pancreas. Now you may ask, what's the big deal? Can't it be treated with a tablet? The answer is no. Acute pancreatitis can become very serious. It can cause your kidneys or lungs to stop working. It can lead to pus or infection inside your belly. You can get internal bleeding. In some people, it can even lead to death. I've seen patients who came too late and needed ICU treatment and long hospital stays. Some survived, some didn't. So how do we treat it? There is no direct medicine to cure pancreatitis. The main goal is to give rest to the pancreas and support the body while it heals. We do this by giving fluids through the vein, giving pain relief, stopping all food or drink for a few days, monitoring the patient closely, sometimes giving antibiotics if there's an infection, treating the cause, like removing gallstones later. Our patient stayed in the hospital for 5 days. Slowly, her pain reduced, her vomiting stopped. She started eating soft food. We scheduled her gallbladder removal surgery after a few weeks to prevent it from happening again. You can reduce your risk of pancreatitis by following a few simple tips. First important thing is lose your weight, as we have seen those with obesity are at higher risk of severe pancreatitis. Avoid too much oily or fatty food. If you have gallstones, get them treated early. Avoid alcohol. Control your cholesterol and sugar. Don't ignore long-lasting belly pain. Always consult a doctor instead of taking random medicines. Your health is in your hands. Today's story isn't just about one patient. It's a warning for all of us. Many of us think stomach pain is always gas or indigestion, but sometimes it's something deeper, something dangerous. The earlier you get checked, the better your chances of recovery. That woman survived because she came to the hospital on time. So please, take belly pain seriously. Talk to a doctor, don't wait. If this video helped you understand something new, please share it with your family. Comment below if you want me to cover other topics like fatty liver, IBS, hepatitis, or jaundice in simple, real language. Thank you.